activity. So this would further motivate the patient to do the activity, since patient now knows that there's this something happen inside while doing the activity. So that's the kind of principles of biofeedback. So here, patient would tend to regulate the activities of siya more mag-control sa activity kasi siya mag-contract sa muscle. So, and then patient will be aware of what's happening inside. So with regards to the biofeedback modality, as you mentioned, it gives information to the patient. So the information will be given in the form of certain signal, and you have two signals there based on our modality that are present here. So by the way, there are several types of biofeedback, and we are focusing on EMG biofeedback, electromyographic biofeedback. So natin i-focus in pit 8. So you have several biofeedback naman there. So in this devices, with regards to the information that will be given back to the patient, it is in a form of two signals. One is through visual signal, and the other is auditory signal or audio signal. Okay. So with regards to the visual signal, so this would be perceived by the patient through his or her vision or visual sensation. Okay, so expected here, if you're going to provide visual signal, then the vision or the visual sensation of the patient should be intact. Naagin siya, makakita niyo siya with regards to the signal there. If ever patient is impaired vision, so you can expect a visual signal to be delivered to the patient, the impairment or blind patient. Another signal there is in the form of audio signal. So therefore, we expect that the patient should have a normal or intact audition. So if ever patient cannot hear, so you cannot do audio signal there for biofeedback. So here, since the modality can able to provide visual or audio signal or perhaps both, so you would expect that patients, if ever patient had either one of this sensation, visual or auditory, so okay na siya to undergo biofeedback. If both, okay ra good Japan, much more. But if ever impaired gani ang both or absent ang both, then useless ang biofeedback. So you cannot, so it's contraindicated, or you cannot do biofeedback training for those patients who cannot both see and cannot hear using this modality. Unless there are still other modality that you can use, like vibration or what. But based on this modality, kay visual man auditory, so hindi siya pwede if the patient is both blind and deaf. Okay. And then also, in biofeedback training, you have to instruct the patients on the instructions. So therefore, we expect patients should have to understand mga instructions, simple instructions, or much more if ever complicated instructions, can understand the patient better. But enough na the patient can able to understand simple instructions. So you just provide simple instructions if ever patient cannot understand that much of a complicated instruction. Okay. So there. So with regards to the conditions that we can treat biofeedback training, so we have two general conditions here. One condition is if ever the muscles are weak or flaccid or totally paralyzed that it cannot move, or we have this hypotonic muscles, so we can apply biofeedback training. So our aim here or goal is to further increase the muscle activity or your myoelectric activity, so to enhance, to increase, so that there will be more muscle contraction, muscle movement there, or what ma-produce. So another conditions there is if ever the muscles are spastic, are rigid, or tense, or tight, or probably hypertonic. So we can also do biofeedback technique. So our goal here is to reduce the activity of the muscle or to reduce the myoelectric activity there. So that's right. So regardless of whatever cases that you would encounter, like might be stroke, TBI, SCI, or whatever there, myofascial pain syndrome, or torticollis, or what, if ever any of this problem, it might be there will be weakness, flaccid, or tight, or tired. So pwede nyo may-apply feedback technique. Yeah. So are there any questions at the moment? So here, there are several types of modality. Unfortunately, this one is not that really functional. One problem is before, these are not the original electrode here. Before, nakat, naputol man siya, we try to replace that one. Unfortunately, di kaya siya mo-function, di kaya reliable in that aspect. Mag-issue nyo order or replace another electrode yung mga old model mo siya to makuha pa ang machine actually. And another problem, although before, mo produce na auditory signal, but lately, yes,